This is a collaboration with the Copenhagen Cryo Clinic on how to do a cryoneurolysis for flexed fingers. In this case, it was identified that the bending was at the proximal interphalangeal joint, which is controlled by the flexor digitorum superficialis muscles. Those are found on ultrasound just below the pronator teres and flexor carpi radialis above the flexor digitorum profundus. First, the skin is frozen with lidocaine. Next, we pass the catheter in. This video is sped up for efficiency. The catheter goes in, making sure that we avoid the blood vessels in the area, and Doppler will help that. Here we've turned on the Doppler to make sure we avoid the blood vessel. Next, the cryoprobe is inserted, and here it is the Iovera handpiece by Pacira, inserted into the area. It is attached to a nerve stimulator, and we stimulate at less than 1 milliamp, preferably as low as 0.5. Here you can see that the muscles are stimulating. There are, of course, 4 fascicles of flexor digitorum superficialis, 2 on top of the other, and we want to make sure that the fingers are all stimulating. We also want to avoid stimulating the flexor digitorum profundus in this case, as it was not necessary. Each cycle of this cryoneurolysis machine is 106 seconds, and you can see the ice ball is forming here, and you can see fasciculations happening in the area. As the nerve is denervated, we see fasciculations occurring. The ice ball will form and then thaw in the 106 seconds, and then it will be repeated. You can see right away the hand is already open, and the assistant is showing that the hand is becoming loose right away. That ice ball will form in about 15 seconds and will cause a nerve conduction block, and immediately the hand will relax. Overall, there will be 2 cycles to make sure that it is complete. The net result that the fingers will rest open instead of being curled. This will help with relaxation of the fingers, hand hygiene, and sweating. Now, we are seeing that the hand is very relaxed. It's no longer in a curled area. And by taking off the flexor digitorum superficialis tenodesis effect, the wrist can also extend into full extension. Before, it was being pulled into flexion, and it was difficult to bring the fingers all the way back. We now have a supple hand. Interestingly as well, the thumb was curling into the palm, but we felt there was likely a tenodesis effect, and we did not have to do the flexor pollicis longus. It would have been just as easy to do the flexor pollicis longus in an intramuscular location for the cryoneurolysis, very similar to the localization for botulinum toxin injections or needle EMG. And now we have a relaxed, supple hand.